Doctors' requirement to get superior at possessing hard conversations in moribund patients and not fair in their definitive days, onto a paper of the King School of Physicians. It says doctors should say to human beings who could die during 12 months, who may be fragile or incurably bad, and offer them option above their next thoroughness. But the paper says how seldom happens, and doctors should be more than anticipatory. It recommends comprising household, friends, and carers in the talk too much. Though doctors say they discover these types of conversations stimulating, the paper told it was essential they didn't timid off of them. It told doctors in all areas of health should attract in a patient who requested to say on moribund. But it really TB a off, checkmark box occasion. Linda Magistri set up a mercy named the Nice Sorrow Confidence following her man dead of carcinoma. She says she was stunned by the way he was said the end was shut. They virtually fair told thou ve got weeks to dwell, or, sorrowfully, it was made in an environmental how wasn't individual down there were 5 human beings about the cot, pagers were departure off at the identical period, it was really chaos. How was a individual time and a very considerable time for him, and it should include been made more than sensitively. 1 in 3 adults acknowledged to clinic in a severe disease or trauma, and 80% of thoroughness household residents are alleged to be in their recent year of lifetime. The General Care Justice says patients should be deliberate to becoming the end of their lifetime if they, but just a block of patients in these categories are taking into account the opportunity to talk the end of their lifetime in a physician, the paper says, and such in cardiac fail, imbecility and fragility are lot less than potential to be identified. Almost part of all deaths in England occur in clinic, and 25% of human beings who die down there include been in clinic for more than rather than a monthly. But surveys propose hospitals are wherever communicating on the end of lifetime is poorest. The paper suggests younger doctors don't get quite hands-on learning speaking on moribund in actual patients. Dr. Victoria Tsortsiutan, of the King School of GPS, told patients should sense calmed how GPS were very trained to include susceptible conversations in them and their families. She told, this whole relation among GP and patient is relying on nice communicating, and we include a distinctive part in the NHS of considerate for our patients, of while they are unborn to the end of their lives. We are happy how the paper key points the N expect it will assist GPS and some health professionals in their conversations on these essential issues. Professor Andrew Goddard, CEO of the King School of Physicians London, told, "The is not fair on palliation thoroughness in the definitive days but on possessing a episode of conversations lot over following a terminus diagnostic." Professor Lady Jen Dacker, the early CEO of the RCP, told, "Patients' importance and gain of precise conversations on the end of lifetime. These conversations are hard, but we requirement to get superior at possessing hard conversations."